And this is why this morning here at ABC 15, we are addressing your concerns. Once again, we are joined by Will Humble from the Arizona Public Health Association and Dr. Frank Lavecchio with Valleywise. And we want to get right to some of these viewer questions. Our first one this half hour. Here we go. Well, this is for you. Should people who have already had COVID get the vaccine and also continue to wear masks?
Yeah, so the first part of that question is if you know that you've been infected with COVID-19 with positive PCR tests, for example, and recover, I think it's your responsibility to stand at the back of the line and let the people who have not had the disease to get the first doses of vaccine. So that's a basic common courtesy. Eventually, you may be able to get the vaccine, but if you've been infected, please don't take a vaccine that will help somebody else. So that's that first question. The second thing on the masks is, I think the broadest way for me to answer that is to say, hey, look, we've all been in this thing together since March. Let's stick together and continue to wear a mask, even if you have been infected with the virus and recovered, or after you get vaccinated. People in the community don't know whether you've been infected or not. And the more we can stick together and get good compliance with mask wearing, the better off all of us will be.
It's about easing that fear, right? Just trying to make sure everybody feels okay, because stress can only contribute to COVID, as we've learned here over the past almost 12 months. Okay, want to get to a question. This one is coming for Dr. Lavecchio. Is the vaccine safe for people with autoimmune conditions?
Great question. Again, I think the short answer is we don't know. I think it's not contraindicated, means that they did not exclude people with autoimmune disease from the trial. So if you had autoimmune disease, they kept you out. Why did they do that? Well, it's because they didn't know if you're going to develop an appropriate response or not. What I'm trying to say is that if you have autoimmune disease, your antibodies might not rise as high, and it would kind of cloud the data. But on the package insert, the only contraindication is if you're allergic to the vaccine, which is very, very rare. About 1 in 18,000 patients develop anaphylaxis. So right now, the recommendation is to get it.
Okay. Can I just say thank you when you say we don't know? It helps us gain trust, because, this is uncharted territory, right? The next question is for both of you. Mary Jane writing in, again, it's ask@abc15.com. She asks, if a person has peanut, eggs, or sulfa allergies, should they get the vaccination?
Dr. Lavecchio, why don't you take that one?
Okay, so the short answer is there's no peanut egg allergy, or there's no peanut or egg in the vaccine. So you would be fine. However, people that are allergic to multiple things are allergic to other things. So the only contraindication, again, is if you're allergic to the vaccine, okay, which is very, very rare. So don't worry about it if you have egg allergies, peanut allergies. What they did in England, what they're doing in England right now, they're rolling out a little bit sooner, is they're having an EpiPen available, which is pretty prudent. I think you should have that any place they're giving vaccines.
And especially if you're high risk, you should try to get the vaccine, even if you've got that kind of condition. And what they'll do is they'll have you wait for a half hour after you get your vaccine, and they'll have, like Dr. Lavecchio said, an EpiPen, which could help relieve the symptoms of any kind of anaphylactic reaction that you have. So if you've got high risk conditions and you've got allergies, you should still take an effort. And they just may, you'll wait a few minutes after the vaccine, but you can do it.
Okay. Again, giving us some trust here and hopefully easing anxieties as these vaccines are making their way to Arizona. Thank you so much for allowing us to pick your brains this morning, and for allowing our viewers to ask these questions that will hopefully calm at least some fears. Thank you, you guys. Nick?
Thank you.
Yeah, Kaylee, some great information. Now, some people are calling the distribution of the vaccine the largest logistical effort the country has seen since World War II. Over the next few months, millions of doses will be distributed. I'm joined once again by former Director of Emergency Management here in Arizona, Wendy Smith-Reeve. Wendy, we have more questions for you. Let's get to our first viewer question for you. Cora Lee asks, will winter visitors who are not residents of Arizona be allowed to take the shot here?
So the answer is yes. So those part-time residents to Arizona, our snowbird population, as we refer to them lovingly, yes, they will be eligible to receive the vaccine here in Arizona.
Okay, yeah, obviously we have many of them here, and we love when we have our winter visitors, of course. Also, the next question is, are they going to give a proof of a vaccine when you get the shot? So sort of like a vaccine passport, we've heard it called. People may need one for work, to go back to college, concerts, sporting events, etc. What do you make of that?
So my understanding is that there will be an item that's given to you, a card, if you will. Think back to when you had vaccine cards and you kept track, and some of us did for our kids as parents. So understanding that that is going to be a documented item that will be provided to you, because obviously you also have to come back for the second dose at 21 to 28 days later.
Good point, Wendy. We know that this is, of course, going to be a phased-in approach for all of us to get vaccinated. How will various groups of people in these phases be notified?
So the media is obviously a great source of information, and ABC15 has been on top of this and is rolling out information just as you receive it. Also, Department of Public Health or Department of Health Services, they have been providing information timely, as well as the county health departments. So there's a lot of information out there. You just have to seek it out and pay attention.
All right, last question for you, Wendy. How does the state know how many vaccine doses to order, and what happens if the state maybe orders too many or doesn't have enough?
Great question. So we do have a lot of case counts or counts of population. So we know how many healthcare personnel are here in Arizona, how many individuals are at long-term care facilities and the like. So they are also receiving allocations based upon population for the state. So they are in constant contact and asking and putting in those orders for the vaccine and distributing it as far and wide as possible.
Yeah, and maybe even using some demographic information to try to figure out exactly how many, because clearly a state like Arizona with a little over 7 million people wouldn't need maybe as many doses. California next door, which has more than 50 million people. Excellent, excellent answers for you, Wendy Smith-Reeve. Thanks for taking action for us and getting us these answers to our terrific viewer questions. We have some really smart ABC15 viewers, I think, who are really dialed into this process. Wendy, thank you.